Warm welcome to each and every one of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring the diverse landscape of advanced nursing care around the world. My name is April Kapu. I'm the Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I will be moderating today's session. Please let me take a moment now to thank Megan Allen and Betsy Usher, who have supported me and partnered with me along this journey this year, and to all of our colleagues and coworkers who have presented and joined these informative sessions. The purpose of this series has been to go beyond borders. It's a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice, education, and regulation. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. So today, as we embark upon this journey and listen and just really hear the remarkable stories and experiences of our esteemed presenters, I would ask that you all please put your mics on mute. And then at the end of their presentation, we will have plenty of time for question and answer with our panelists. So I would love to introduce them at this time. So we will be hearing today from Dr. Carol McAvey. She is an associate professor at the Cizik School of Nursing at the University of Texas Health Science Center. She coordinates the MSN and Postmaster's Nursing Education programs and teaches in the BSN to DNP and MSN programs. After earning her MSN FNP and DNP, she has been involved in advanced nursing practice education for over 18 years. Her interests include advanced practice nurse role development, competency-based education, gamification for student engagement, and simulation to enhance clinical skills and knowledge. We'll also hear from Colette Henderson, who is the Advanced Practice Program Lead at the University of Dundee and has national, United Kingdom-wide, and international roles in advancing practice. She founded several Scottish advanced practice networks and is the representative for the AAPE UK and ICN NP APN. With over 20 years of clinical experience, Colette also leads research on doctoral education for advanced practice and has developed innovative services in primary care. And then we will also be able to hear from Sophie Petrie and Olivia Worrell, who are research assistants for the famous, I can't wait to hear more about this, for famous with Catholic University of Applied Science in Mainz, Germany. FAMOUS is a research project which explores the outcomes of advanced practice nursing care and primary health care in Germany. So we are delighted to hear from all of these esteemed presenters on advanced practice nursing, education, regulation, and practice in Germany. So without further ado, I would love to turn the time over to Dr. Carol McAvey.
Hello, everybody, and welcome, and thank you for having us. I want to preface this by saying that I am in the United States. I am not in Germany, nor have I ever practiced in Germany. However, we were invited, Colette and I were invited to sit on a panel in Germany and to address the advanced practice role and some of the problems that go along with implementation. So, taking a look at this in general, there's a driving force behind APN development. A lot of it has to do with healthcare professionals. In Germany specifically, they have a huge aging population and they need increased healthcare. In general, around the world, there's a provider shortage. There are health inequities. There is access to healthcare and there are educational issues. So all these things are driving. There are about 70 countries that are either looking to develop or enhance APN development, a role development in their country to address some of the issues that they're having. So let's take a quick look at the German healthcare system. They have universal coverage, which means basically the insurance is mandatory for everyone. They have a statutory health insurance, And that seems to be funded through wage contributions, basically by employers and employees. Um, and it handles most of the services, inpatient, outpatient, things like that. There is also, I have to figure out where to move it forward. There is also private health insurance. And I found this interesting. Private health insurance is, you actually have to be able to afford it. This is the health insurance that can be purchased. It does provide extensive coverage. It provides faster coverage to specialists, but it evidently is quite pricey. And overall, the system is decentralized. So we have healthcare governance is divided not only into federal and state, but also there are some corporate bodies that are able to address some of it. So the decisions are done at a local level. So it's going to be rather the regulation of a role for all states and areas would be rather challenging. There is their funding and costs. Germany spends about 12.9 of their gross domestic product on healthcare. They're rather high for European Union members. In the United States, though, we surpass everybody with this, with 17.3 of our gross domestic product is related to healthcare. In the UK, it's about 10.9. So Germany is falling somewhere in the middle with this. The statutory health insurance covers most people. There are, I wanted to say, I was trying to think of there about most of the people, about 80% of the people are covered. There are some people who still are not covered. And this is an issue for them. The German Nursing Association, I'm not even going to try and pronounce it. I had Google telling me how to pronounce it a couple times and I still managed to butcher it, so I'm going to leave it alone. Was founded in 1903 by Agnes Kroll. She was a big advocate for the nursing profession. It has a central location in Brazil and in Berlin, and there are also some regional offices. Its role is basically representation of nurses, both federal and at federal and state level. So they look at policy and healthcare reforms. They are members of the ICN conference, or International Council for Nurses, and they are also part of the European Federation of Nurses. They work with advocacy, so they're looking for professional development opportunities, pay, workplace problems, and they look at education and training. Their education and training seems to be more supportive for continuing education and development and nursing development. So those are the kind of things that are the backbone of their healthcare. So from there, you're now trying to implement a role that people are unfamiliar with. And Colette, I'm going to let you take over from here.
Thank you, Carol. So just to get a bit of understanding, I'm also going to advise that I haven't worked in advanced practice in Germany either, so you might notice my Scottish accent too. So advanced practice nursing in Germany is really in an embryonic stage of development. There's no specific laws, there's no recognition of autonomous practice for advanced practice nursing, which is very similar to where we are in the UK as well at the moment. So what we've found is where we don't have laws and regulation, there is variation in practice and variation across the region. So the lack of standardisation of nursing roles and education systems leading to that variation in practice. So advanced practice nursing, though, is better established in acute care settings. And Carol, I can't move the slides on, so I wonder if you, thank you. So in terms of scope of practice, the scope of practice is evolving. So traditionally more focused on the hospital settings, but a growing recognition in many areas of that need to focus on primary care. And Olivia and Sophie are going to speak to us about the work, about the famous projects and the work that's going on within primary care just now to try and address some of the shortages of general practitioners, particularly challenging within rural areas, which I think we can all appreciate that challenge as well. So nurse practitioners within Germany can provide comprehensive care, and that includes diagnosis, includes managing common illnesses, prescribing, and promoting health and preventing disease. So in terms of education, within Germany, nurses typically need to complete a master's degree. The educational focus is on clinical skills, leadership and research, and the programmes include both theoretical and practical components. So again, something that we can very much relate to across countries. In terms of regulation, there isn't regulation at the moment. There's no registration for advanced practice, so it's very difficult to really capture what's happening when you don't have that registration for nurse practitioners. There's no legal regulations in place to protect the title either, so that, if we compare it to the UK as well, has led to misuse of titles too, so it's not uniformly recognised across federal states in Germany. The framework's still being developed, but there are some pilot projects underway to understand and integrate nurse practitioners more fully into the healthcare system. The Florence Nightingale Hospital implemented advanced practice nurses in 2010. So the aim there is to integrate extended and specialised nursing interventions into the interdisciplinary care process. And areas of responsibility. So advanced practice nurses are assigned to specific departments, and these encompass a wide range of patient-orientated and patient-remote activities. So some of the examples of the areas that advanced practice nurses are assigned to are listed there. So quite wide-ranging across anaesthesia, intensive medicine, pain therapy, gynecology, GI, paediatrics, neonates, paediatric intensive care, psychiatry and psychotherapy as well. So handing over now to our amazing colleagues Olivia and Sophia, who's going to tell us more about the famous project. Thank you.
Thanks, Colette. My name is Olivia, and together with my colleague Sophie, we are research assistant in a project which is called FAMOUS, and I think it is really famous in Germany. You will learn about it now. Thank you for the opportunity to be here today and present it. And we will start with some general information about the project. FAMOUS is a research project at the Catholic University of Applied Sciences in Mainz in Germany. It investigates the care of multimorbid adult patients by APNs in GP practices in Germany. Professor Dr. Renate Stemmer is the leader of this project, and it is funded by the Innovation Fund of the Federal Joint Committee. It is very important to know that it is the first time, just one back, Carol, please. It's the first time that APNs have been involved in primary care in Germany, so it is a real innovative project in Germany's health system. We started in October 2020 and will end this December, so I think it's just about 2 weeks left, with an evaluation of the impact of this treatment. The project took place throughout the state Rhineland-Palatinate in Germany. On the map, it is the colored area in dark blue. And you can see some impressions from Mainz, the capital of Rhineland-Palatinate, and the main location of the project. So very welcome to come to Germany. The reasons for the project are similar to the reasons for the international implementation of advanced practice nursing in primary care. An increasing number of multimorbid patients and a growing shortage of GPs, especially in rural areas, meet an increasing number of nurses with master's degrees. The potential that APNs bring to the complex needs of multimorbid patients is person-centered and evidence-based care. This allows APNs to enter a very new field of work where GPs are no longer the only profession involved in patient care. So the responsibility will be shared among multiple professions, and this is very new in Germany. Famous pursues the following 4 aims. First, stabilization of the health and home care situation of multimorbid patients. Second, reduction of emergency contacts and use of other care institutions. And furthermore, ensuring continuity of care when switching between care providers. And last, relief for GPs, particularly in rural and structurally weak regions. FAMOUS is a non-randomized intervention study with a control group. In the intervention group, around 873 multimorbid patients received APN care. In the control group, the number of integrated patients was twice as high. This means that the control group comprised around 1,700 patients who received standard care. The data is based on routine data from health insurance companies. Patients with at least 3 chronic diseases could be cared for by APNs. The further inclusion criteria were under treatment in one of the participating GP practices, at least 18 years old, have statutory health insurance, and not be in the terminal phase. Let's have a look at the patients. In median, they were 82 years old. 35.7% of them had more than 10 chronic diseases. Just remember they should have been 3. And 46% of them lived alone at home. So these are therefore very old people who live in a very complex health situation. And Sophie will go on.
Yes, hello everybody. I will now explain the qualification and task profile of the famous APNs in more detail. All APNs had 3 years of nursing education as professional training, ended up with a professional license after passing their state exam. This is the normal German way for being a nurse. And in addition, they passed nursing studies, which lasted typically 5 years, which is very rare for nurses in Germany. Ending with a master's degree in the international, ending with the master's degree is the international precondition for working as an APN, and FAMOUS used this standard for this definition of APN. In the project, it was necessary to have at least 2 years of professional nursing experience in any setting. And no, please, one slide back. Because APNs are not established in German GP practices, that's why all of them got an additional project-specific training, and it comprised 500 units with seminars and high amount of reflection about getting and being an APN. In general, APNs deal with complex care situation, network with other care providers, and manage the care process evidence-based. And they were not allowed to decide independently in all caring areas. They had to discuss with the GPs and make recommendations, for example, for changing medication, therapy, or counsels with consultants. They worked independently within the nursing process, starting with the assessment and identification of support needs. Then they developed the individual and person-centered evidence-based care plan. And the APNs also monitored and evaluated the care plan independently. In addition, they managed the information transfer and interprofessional collaboration. Let's now have a look at some results, and I will show you the perspective of APNs and GPs. You already heard about the recommendation the APNs made. The APNs were required to make a recommendation if it was a physician's conditional assignment, and areas included, for example, medication, pain, and mobility. In total, there were 14 areas, as you can see on the right side. And we analyzed in total 5,839 recommendations and checked how often the GPs accepted or rejected the recommendation. And we are very proud to say that in total, 94.7% recommendations were fully implemented and only 3.6% were not fully implemented. And the areas which were frequently discussed were physical health, medication management, and metabolic instability. You can now hand over to the next slide, please. Yes. And GPs were asked how they experienced the interdisciplinary work with APNs, and 26 of 42 GPs answered the questionnaire. And the most impressive results are as following. GPs agreed that patients received a better medical and nursing care and a more efficient use of medication. The GPs were undecided if they could care for more patients thanks to relief of APNs. I think it's because of the short time the APNs worked with the GPs together. It was only for 2 years, so the system doesn't change that fast. And despite the short time they have been working with APNs, GPs are realizing that being the sole point of contact for their patient is no longer appropriate. And this is a very, very big step for Germany. And I now hand over to Olivia again.
Sorry. In conclusion, GPs are very satisfied with their interdisciplinary work with the APNs. The participating GPs show great openness and support for the implementation of APNs into standard care. But as you already know, the legal framework complicates this very, very much. All in all, Carol, yeah, thanks. FAMOUS represents an important first step that shows the potential of APNs in German primary care. Though the initial feedback was very positive, many legal changes are still required. FAMOUS strengthened the respect for APNs and their pioneering work. Here you can see some of the APNs and some of our colleagues from the team. And now we want to say thank you to you, and I think the Q&A is open.
Wonderful. Thank you so much.